Vastus lateralis, very large muscle, hence the vastus part. And those fibers are going to angle into patella this way. So if I have him try to straighten his leg, we can kind of see the outlines of that muscle. And it tapers in here, but all the way back. So these fibers even underneath the IT band are part of that muscle. So very long fibers. So that's a lot to do with your hands. Sometimes the very distal fibers are ones that will cause very severe knee pain. And I'm going to just do some local palpation here, soften the muscle a little bit, and have his leg nearly straight, just so I can see. I'm not feeling a whole lot here, actually. What does it feel like?
I think you softened up a lot of it.
That's crazy, yeah. I think I already did.
As far as sensitivity, there's none.
Yeah.
I mean, absolutely feel nothing.
Yeah, not feeling much. So, and we did a little bit in working with the rectus there, but yeah, I don't.
No, that usually destroys me, that much pressure. Right
Yeah, yeah. It's feeling pretty good. So there's such a synergistic relationship too, you know, because we worked the VMO. So the VMO is a synergist of this muscle in some ways. In some ways it's actually antagonistic because of the patella, you know, so it's pulling, countering that pull on the patella. So you have that neurological relationship. So I'm gonna go right into this. So same thing, you might be able to see some fibers stand up, twitch response is happening. Yeah.
My peroneals are twitching too. I can feel my lower leg.
Yeah, and this will send pain below the knee. A little more in the high muscle. So a lot of what people call IT band pain is this muscle, because its referral just goes all the way through here, all the way to the top of the hip. It'll feel like it's your IT band, but when you're rolling your IT band, you're primarily rolling this muscle. And so we'll do a little movement. Now this sitting under from below, we can get at the posterior VL fibers, which will cause actually posterior knee pain. So when the person reports that, you're going to have to get involved with the hamstrings and the VL. That's very easy to do in this position. And I can totally support it on my body. Kind of there. So that's that posterior edge. Now I'm seeing your hamstring tendon pop. So I might be getting some hamstring there.
When I get out of chairs and move up and down, that springs back and forth.
Okay.
So that it's always,
yeah, I think we're just at that crossover between the biceps femoris and the VL. All right. Then very easy also to do contract relax in this position, same idea. So he straightens his leg. And exhale. Just trap and heel to butt or as far as they can comfortably come. He's got no problem with that.
I don't think you could go over a 5 if you tried now.
Okay.
There's just nothing there.
Great. Yeah, it feels actually even under stretch feels pretty soft.